Well, I'm Mauricio Massa. I am the counselor here of counselor advisor here in OPE in Pajo, and I am so happy to be here to welcome you in this important day, the World Cancer Day. So, I let me remind you how the interpretation works. We have presentation in English, but we have something else that we're going to share with you. So you can raise your hand. You can, sorry, write down on the chat where you're coming from, so that we know where are you joining us from. And you have a button there. This webinar will be translated into English and Spanish. So please pick your language so that you can be able to choose the language of preference. Also, we have an area that you may be able to write your questions on in case that you have some, and we will try to answer them as we move forward. In order to start our meeting, we have the great pleasure to be able to share with you a video that our director, Jara Barbosa, prepared in this important day, the World Cancer Day. Today, that we are celebrating the World Cancer Day, it takes us back to a commitment together for the only thing that we care. That motto reminds us that everybody lives cancer in a different way, and this is why it requires answers that are focused on their specific needs. In that same context, the PAHO renews their commitment to focusing on cancer and people, and we situate in our main agenda the cervical cancer as an important topic. This is one of the most preventable cancers and curable. Nevertheless, more and more than 78,000 women receive a diagnosis, and more than 40,000 they lose their lives caused to this devastating disease. These amounts reflect inequality of services and access to vaccination against HPV, diagnosis, and also on time treatment. We are aware of that reality, and this is why we have committed to be able to eliminate cervical cancer, and we have an action plan on prevention and control of cervical cancer in the Bajo. This plan is aligned with the global strategy for elimination, and we establish clear targets for 2030. We want to cover 90% of coverage for HPV, 70% of screening of high performance tests, and 90% of access to treating precancerous lesions in cervical cancer. So these are very ambitious goals, but we can reach them if we all act together.
HPV vaccination is now available in 49 of the 51 countries and territories of the Americas, with a regional coverage of 70% for the first dose among girls under 15 years of age. Additionally, 24 countries and territories have already adopted a single-dose schedule, improving equity, coverage, and sustainability. Yet, challenges remain. While 14 countries have introduced HPV testing in their screening programs, coverage is still limited and data gaps persist. Likewise, only 18 countries report the availability of radiotherapy services, leaving gaps in treatment across the region. To accelerate progress, PAHO is working hand-in-hand with countries, providing technical cooperation to develop and implement national elimination plans, expand HPV testing, support innovation and the production of new and more accessible testing tools, and increase equitable access to vaccine, screening, and quality treatment technologies. Through the PAHO Regional Revolving Funds, member states are procuring HPV vaccines, HPV tests, colposcopes, and thermal ablation devices at affordable prices. These tools, especially at the primary care level, are essential to closing gaps and ensuring that every woman, everywhere, can access life-saving care. Elimination will not happen in isolation. Collaboration is essential. Government, civil society, and international partners must work together to make cervical cancer elimination a shared and urgent priority. In this spirit, PAHO is proud to partner with the Spanish Agency for International Cooperation and Development, AECID, and UNITAID to strengthen prevention efforts, expand early detection, and ensure access to timely, high-quality care throughout the region. On this World Cancer Day, PAHO reaffirms its commitment to a future where cervical cancer is no longer a threat to women and girls. Together, we can make elimination a reality and help reshape the future of cancer care, one that puts people and communities first and leaves no one behind.
Bueno, muchísimas gracias a nuestro
Thank
director
you
por
very much to our director for sharing this important message with the all region and supporting the commitment that we have to eliminate the disease. In order to be able to have some opening remarks, I'm going to leave you with the Dr. Sunset Mechanics from the non-transmissible diseases.
And warm greetings to you from cold Washington, D.C. Greetings to the honorable representatives of Ministries of Health, National Cancer Control Committees, PAHO country office colleagues, development partners, academic institutions, and each and every one of you who are joining us today. So my name is Anselm Hennis, and I'm Director of the Department of Non-Communicable Diseases and Mental Health at the Pan American Health Organization. And it is indeed my pleasure to welcome you to this important commemoration of World Cancer Day 2026, dedicated this year to supporting the elimination of cervical cancer in the Americas. As you have heard, cervical cancer remains one of the region's most inequitable diseases, largely preventable, but yet still responsible for thousands of deaths every year. The World Health Organization Global Strategy calls on us to reach the 90-70-90 elimination targets by 2030, aiming for 90% HPV vaccination coverage, 70% screening with a high-performance test, and 90% treatment of precancerous lesions and management of invasive disease. Today's event highlights the momentum building across Latin America and the Caribbean to achieve these objectives. This aligns with PAHO's Plan of Action for Cervical Cancer Prevention and Control 2018 to 2030. This webinar will launch the Cervical Cancer Dashboard to strengthen monitoring and accountability, present the global and regional vision of ICID and UNITAID to support cervical cancer elimination, and introduce PAHO's planning tool for HPV screening and treatment designed to guide national implementation. We also plan to showcase products available through PAHO's regional revolving funds, including HPV vaccines, high-performance HPV tests, colposcopes, and thermal ablation devices, which are all critical tools for advancing prevention and treatment. The commitment of governments remains essential. Many member states have already taken significant steps, such as adopting the single-dose HPV vaccination schedule, expanding HPV testing, and implementing innovative approaches such as self-sampling for screening. PAHO will continue supporting countries with technical cooperation, national plan development, and strengthen capacities to ensure access to prevention, diagnosis, and treatment. As we begin today's program, I extend my appreciation to all partners, speakers, and to participants for your dedication to the cause. Together, we can transform the elimination of cervical cancer into a public health victory for every woman and girl in the Americas. Thank you. I look forward to your full participation and to the discussions that will follow. Welcome.
Muchísimas gracias, doctor.
Thank you so much, Doctor. And definitely, this is going to be a victory as a region to be able to eliminate cervical cancer. Thank you so much for your kind words. Now, we know that there's no doubt that we need to reach the goals. In order to reach the goals, this would not be possible if without the strategic partners. So the next two presenters will be talking about how their organizations are not only supporting the region but the whole world. For me, it's a great pleasure to present Doctora Oriana Ramirez. She is the head of the Multilateral Europe Organization, AACID. Thank you so much, Mauricio. It's a pleasure to see 590 participants from all the region. I'm so thrilled to be able to share with you to celebrate this day as we did in November of last year, also the World Cancer Day, supporting the elimination of cervical cancer. Now, the fight of the elimination of cervical cancer is a priority for my organization. We are a feminist organization in terms of health. As you may already know, it helped us a lot. The first World Forum for supporting the elimination of cervical cancer, it was called Call for Action, back in March of 2024 in Colombia. It was organized with the government of Colombia in our education center in Cartagena. And back then, our Minister of Foreign Affairs announced the commitment to be able to invest $10 million in the next 3 years in prevention and treatment and elimination of cervical cancer. Also, at the next year, in June of 2025, we had a second worldwide event in Indonesia where Spain also was a participant and even an organizer, as a matter of fact. So how are we fulfilling this commitment that our minister committed to back in 2024? Well, we're working with the World Health Organization, the Pan American Health Organization, and specifically with the WHO. We're going to work with the department that is dedicated to this type of disease, and specifically the cervical cancer. But we're also working, I mean, those funds have dedicated in four countries, Ethiopia, Marruecos, and Mozambique, in order to be able to bring them and to help them in even some cases with vaccination campaigns. In some others, we are dealing with part of the treatment or training, communication, and with the WHO, the same way. I mean, this is a multi-annual commitment for 3 years. And as our colleagues mentioned from the PAHO, within their program that they're dedicating into developing training tools, disseminating information, treatment. Also, we have started a very small project, but we believe that is a wonderful project, because all governments from Bolivia, Paraguay, El Salvador, together with the WHO and the Catalan Oncology Center, they are going to have a cooperation project to develop strategies that can be able to be focused on a vulnerable population, indigenous people, foreigners, immigrants, and also in another aspect, Spain, as you know, it's a donor of Unit 8 that is here with us today as a partner, and they're promoting tools for early diagnosis. And lastly, let me just tell you that we have other smaller projects with NGOs or bilateral programs. There was an innovation invitation project with AI in Guatemala, and we are embarked in that program, and we are bringing to the rural areas screening tests supported by AI and with with the support of a Spanish company, two organizations. And we are trying to adapt this strategy in such a way that it is developed by the National Institute of Cancerology in the United States, and also in Verapaz, in rural communities, and of course, talking about screening test. Well, as you can see, this is a highly we are highly committed to be able to support the cause. Specifically today, well, I just wanted to talk to you about the close relationship that we have with the World Health Organization. And in this important date, we are so happy of this work, and well, this is how we are working in the at the technical level. I congratulate you all and thank you.
Thank you so much, really, from the entire forum. This commitment between Spain and the entire commitment, it really represents everything of what we're going to be introducing regarding the technical support we're performing throughout the region. This cooperation triangle where we're collaborating hand in hand with Bolivia, El Salvador, Paraguay, I am certain will most definitely see a lot of movement amongst them and supporting the most vulnerable women of society. So thank you so much for your unconditional support, and we'll continue working hand in hand with Unitate's project with one another. Thank you so much for everything. Now we will have the presentation from Unitate, which is Eufemika Defosimi, who is the director of the cervical uterine cancer. Unitate is another incredible partner that has this initiative. We have an amazing project who is going to help us accelerate the strategy and the implementation of the strategy. So thank you so much, Doctor, for being here, for joining us today.
I did not switch to English for you, but just making
No,
that
that's
intro. I'm so
okay.
glad about the work that we're doing together.
Thank you so much. And actually the translation is working perfectly, so I could
Okay,
follow very well.
thank you.
The presentations, and thank you so much also, Mauricio and the team from PAHO for providing us with this opportunity to actually intervene in the webinar on such a special day. And I'm particularly honored to be speaking in front of representatives of ministries of health of such an important regions, both from the perspective of how the region reacts to infectious diseases and collectively actually provides very strong examples of that, but also as a region who has in the past been at the forefront of introducing some of the innovation across different diseases. And especially for us as Unitate, the organization who has since 20 years been the organization who worked on innovation, being able to actually collaborate with PAHO and support some of the organizations in the Latin American Caribbean region has been a particular honor. I have been asked to actually present some of the work that we do to support improving access to HPV testing. And I do want to clarify something that, and I like to show this slide because it's a very strong reminder of why cervical cancer elimination is really a very comprehensive and very important approach across different pillars. As you can see, based on the modeling that actually went into WHO structuring some of the recommendations and also some of the approaches to elimination, over the next 50 years, the most deaths averted will come from actually the second pillar and scaling up of screening and treatment services. And it's also an incredible momentum because we are seeing as well, especially after the COVID infection, we have seen countries having a very strong capacity to do some of the innovations and tests that are allowing us to much more accurately screen and assess women who are at risk of getting the cervical cancer. And as such, in 2018, when the WHO's Director General Dr. Tedros announced a call to action, we immediately stood behind that call. And already in 2019, we started our first set of investments in secondary prevention. And as I said in the beginning of my presentation, it was really around thinking about where the innovation exists in order to kind of also merge the incredible and important call to action with what we as United do, which is introducing innovation. And we really worked since 2019 with an investment of around $100 million on introducing first and foremost HPV tests and looking into modalities of how these tests can be introduced, so self-collection, but also thinking about the treatment of precancerous lesions and going away from working with some of the technologies that were very much not feasible to be used in remote settings and shifting to portable thermal ablation devices. And as I said, the task at the point that we started working was not as complicated as we thought it would be. And to an extent, it is also thanks to, first and foremost, some of the initial investments in HIV and tuberculosis response and building that molecular capacity in countries. But also then COVID came in 2020 and many countries built further their infrastructure for molecular testing. So as you can see, these are the numbers from 2023 where we worked with CHI, the Clinton Health Access Initiative, one of our partners, to map out the existing capacity. And it's a huge capacity that already exists and where countries can also really think through how to use it to scale up their HPV testing. Soon after, we used that information to actually work on quite significant price reductions, both for HPV tests and thermal ablation devices. And HPV tests, it was actually a much easier task than that we thought initially it would be. And this is because we presented to the companies an argument that HPV tests should not be looked in isolation from every other virology test that actually governments use. So we did merge it in our conversations with HIV volumes or hepatitis volumes, as well as some other virology, and argued that the pricing should be either equal, or in some cases, we actually managed to achieve even lower pricing than that of HIV and TB tests. At the same time, we scanned the market for thermal ablation devices and found out that actually there are only 2 companies globally that produce them. And we realized that we would need to work with them in order to stabilize the demand, while we also work with countries to understand how to use the devices. And pretty much at the outset, because we made a volume guarantee, we managed to achieve sub $1,000 pricing for thermal ablation devices. And I really want to emphasize this. And I left also the link to the QR code for participants to access this pricing, because these are commitments that should be available for any public funding, whether it's by government or by organizations that have actually access to public funding. So if in any case you're getting any higher price than $1,000 per device, either from Liger or from VISUP, you should know that this is not what should be offered to you. At the same time, I'm going to shift back to the HPV testing. As I said, we use a lot of conversation around other virology, and that really locked us into much more limited geographical coverage of these access pricing agreements that actually should be benefiting our low and middle income countries. And if you see basically the distribution of the prices, it's quite concentrated in regions which have a higher burden, especially of HIV. And at the same time, we also looked into the differences across different regions of access to different molecular testing pricing, including HPV, but this also was done for other molecular tests. And I have to say that consistently in 2024, when we started digging into what countries are actually paying versus what we should have negotiated in that range of estimated landed prices, it was consistently seen that it's at least double, if not more, in the average price that is accessed by especially LATAM and Asia Pacific regions in comparison to Sub-Saharan Africa, which really led us to that notion that we should look into each region separately. And that really also brought us to thinking about partnering with PAHO and their strategic fund to figure out how we can regionally improve the pricing for HPV tests. And this is something we're working closely with the PAHO team in this year and last year and this year. I also wanted to outline a couple of other issues, and these are very important because in the end of the day, accessing the good prices is just one part of the puzzle. Something that we continue seeing is that with the current technology options, we are unfortunately not seeing the possibility of having the same day visit test and treat or test triage and treat strategy. And that really leads to quite a big drop between how many women actually are tested HPV positive and how many then go into the next step of the cascade of care. And we have seen numerous programs and countries who report high rates of loss to follow-up. And on the other hand, despite price reductions, the financial resources remain limited. And in some countries, we're talking about programs that are only now starting screening. And I know that in Latin America and Caribbean, to an extent, you're switching from maybe considerably similar test types or screening types in comparison to the price offering as HPV testing, but some countries are supposed to switch from VIA, from the visual inspection with acetic acid, and that kind of jump in prices is quite, or the cost is quite substantial. So those fiscal spaces are still preventing us to reach the 70% target that the WHO has set in their elimination strategy. And I have also collected a couple of other examples. So the consistency in that drop in cascade of care is quite relevant and this is in routine programs. Another issue that also I spoke about, as I said, is that kind of limited increase in HPV testing coverage. And these are some numbers from 2024 from countries in Africa where we worked, and you can see that those kind of what the countries would like to reach as target and what they're reaching from the financing perspective is quite different. But we did see that also in the TB space, that kind of increase in testing has been very slow, even though the gene expert has been available since 2010. So one can say that kind of technology introduction does take time, and that there might be some other drivers to kind of slower uptake. I also wanted to kind of focus on two other examples where we worked a lot with some countries, which have been beneficial also from for at least understanding what that amount of money means in practical terms. One is with Rwanda, where we worked on figuring out how much it would cost them to reach 70% over the next years if they basically do the coverage and introduce HPV testing. And this has been an incredibly powerful document because it actually put the number behind the ambition for the government. And at the same time, we also work with, and you can see that for Rwanda, that total investment was around 40 million. And it's a smaller country relatively to maybe some other countries, but it's good to have the ballpark figure and understand what that need is. At the same time, we also work with the Philippines, and you can see their ambition is a little bit different for the next 5 years. It's around 20% coverage, but in terms of the scale of the number of US dollars that they would need to reach the women is approximately the same. And that's why the pricing of HPV test is really important, because most of these numbers are driven by commodity numbers behind. Finally, let me just finish with the very positive news. I know that we have already announced some of our commitments in Bali, the Global Cervical Cancer Forum in June last year, but we have finally launched a call for proposals, which has been open since a little bit more than a week. It is for approximate envelope of investments of up to $30 million, and it is open until early April. We will have a webinar on 12th of February, which will allow participants to either through the registration to the webinar, submit some of the questions and also hear a little bit more about the call. I have pasted the QR code for those of you who would like to find the call. You can also Google it. And I think in the chat, we will have as well the link to the call. Let me end here with, again, thanking for the opportunity. It's been really a pleasure to even think through the presentation that would be relevant for the region. So thanks so much, Mauricio, for giving me that opportunity.
No, thank you. Thank you so much for sharing this and the great work that you've done. And I think through this just opening the conversation to discuss with manufacturers the needs for all the countries, around the world is something that's so commendable. And of course, as PAHO, we're very grateful for the support that's being provided for our region. Uh, the first country that we are working with, St. Vincent and the Grenadines, is doing an incredible work in implementing HPV testing, and ensuring great monitoring and evaluation process and treatment, all of this with other partners. So again, thank you so much for making this available for our region too, this sort of technical support and access to make this possible. So more than happy to share more news about how we're progressing in the other uh, countries in the near future. So thank you again for your time. So now, ahora vamos a continuar, y voy a tener la oportunidad yo de presentarles un poco
Now I'm going to
sobre.
have the opportunity to show you, well, to present a little bit about the panel that we have developed in order to be able to see how we measure the goal in order to be able to accelerate elimination of cervical cancer in our region. I'm going to be able to share my screen. I'm going to share this on the chat so that you can access. We are very happy to receive feedback. What we want is that throughout this type of tools that countries may access to, countries may understand how we are measuring, where the information is coming from. Sometimes we receive feedback of projections, information that we present that sometimes do not reflect the reality of the countries. And what we've tried to do is to make sure that we really give voice to those countries and to tell them how we are recollecting the information. So in this webpage, this is the main webpage where you can access and see, for example, we are talking about the following targets 90, 70, 90 that we heard from the director of the organization as well as the head of our department. And what we want to make sure is that we may be able to show you the progress that we have so far. If you go to this chart, you will be able to see the different essential areas for the elimination. We have vaccines, this is screening, treatment and impact indicators. Let me just underscore that the work that we are doing right now in the PAHO, one of the main strengths that we have is that we may work with, or we work with a lot of areas, and the area of vaccines have helped us a lot in order to be able to implement the HPV vaccine in the region. As you can see over there, we can see the charts, all of the countries that they already have the vaccine. as part of the immunization programs. We have just a couple of countries, but also the schemes. How are we changing that for one doses? For example, most of the countries, they are already moving towards this transition, and also vaccines not only in girls but also in boys. So this is part of the information that you will be able to access. You will be able to see estimates of coverage, program characteristics. We have the schedule of 90%, goal of 90%, and as you can see, we can show you what is the estimate coverages per region. If you go on the map, you will be able to see what is the actual coverage that we have and what are the trends that they have had in the last years in order to reach this last update. Now, if you want to see this on a yearly basis, also, we can see, for example, how we reached 70%, which is the region that is reaching the highest coverage. And we are sure that if we follow this trend, we will be able to reach the target by 2030. So here you can see, for example, if you want to choose the country, you may be able to click here, for example, El Salvador, that they introduce vaccines in the last years. You've been able to increase the coverage. Also, for example, Peru, they're going over the goal, they're growing. And with the tool, you will be able to see and how to compare, for example, numbers, how was introduced, and also all the fluctuations. And then you will have a better idea of the things that you can do in order to be able to improve programs and to be able to share how countries are doing in the region. Now, most of the information that we have here, we did it with the program managers of cancer, as well as immunization programmers in the regions and in the sub-regions. We were able to share a tool online so that they can answer some of the questions in order to understand whether if they had, for example, cervical cancer programs, if they had budget or no, specifically for these, the type of screening. We know that most of the countries, they always or most of them, they will have cytology as their screening, but also we are in the process of transitioning in order to be able to ensure that all of the countries may be able to move towards the HPV test. And also, if we consider the characteristics, you can go over the map and you will be able to see, for example, vaccines, the countries. I'm just going to take an example here. Peru, and it says here, for example, the screening, HPV, estimated coverage per country. And this is a tool that it will be very helpful for everyone. We know that in order to talk about the coverage, this is the only thing that we still have pending because the World Health Organization, they're going to give us a new estimates, and we are expecting to be able to update that with the latest information, and this is going to be published in the near future. Now, you can also see at the treatment level, we know that all of us who work with cancer, that from the data we have certain limitations. So that is why we are presenting here. This is just qualitative. That is whether if we have presence of services, if they have surgical services, chemotherapy. Let me say, for example, that in the Caribbean region, one of the main problems that they face is that many countries do not have the capacity of being able to provide the service, and we need to make sure that we try to help them solve this. Also, the same thing goes by country. In the map, you can see the availability of what they have, if they don't have, if they have, for example, primary attention service. This is the question that we're asking everyone, because first of all, we want to make sure that the countries whenever they start implementing, they try to solve this issue as close as possible to women and girls. And if we can provide them with a primary care, this is the ideal idea world. So we also have the impact indicators so that we can measure, for example, elimination. We know that it's going to take us a lot of years in order to be able to ensure full elimination, but we want to also make sure that we can meet the targets for elimination by 2030, even though that it is true that this is not an indicator of 100% elimination, and this is something that we also presented. We need to talk about mortality, and if we make sure that the pillars of screening and treatment can be addressed in an on-time manner, we may be able to accelerate the process in order to achieve elimination. Also, we have this regional view, and also you can see the progress per country within the different focuses that we have. That is vaccines, screening, according to the information that we have available of each country in terms of the services that they provide. And also in here, you may be able to see comparison between all countries. And also, if you want to go to a specific country, you can go to this tab that it reads country profile, and you will be able to see, for example, coverage, incidence, mortality, screening for cervical cancer, and you may choose exactly which status you want to go over. Now, most of this information, as I was saying, comes from the fact that we work very close with the immunization program and also with the project managers of cancer and immunization of each country. Now, all the technical references of where this information is coming from, you can see that in the technical notes. Now, let me tell you that today we are sharing a lot of information, of latest information of cancer. So we will be able to have a publication that is going to be issued at the last part of the day, and you will be able to see a lot of this information that we are showing here, but with the feedback from countries. And the only thing that we want to make sure is that we're trying to improve, and data, it's a big issue in the whole region. Having good data is a challenge. We know that it is not perfect, but we would like to try, or we're always striving for the best type of data and that the impact of our interventions are truly effective. So with this, I only want to thank Ramon, Martinez, Roberta, Sara, all the team that has helped us to develop this in order to be able to share this with all of you today. I'm very happy to receive your feedback. So the next thing, we're going to continue showing another tool that I believe is going to be very useful in the implementation side. When we are developing these programs, let me tell you that this is not something that we do by ourselves as a PAHO. We have partners, and they're always, I'm sure that they're here with us, the Anderson University of Miami, Florida International University, Basic International, IGCS, and many others that they are helping us. So if there is any interest of anyone that is here connected to help us, we are open to receive your help because we want to receive more and to create more tools. I'm going to pass the floor to Dr. Sara Benitez. She's going to share some of the treatments and screening based on HPV tests. So, Dr. Sara, you have the floor. Thank you, Mauricio. And you went ahead and I wanted to say thank you to all the partners that we have and they have helped us to make this possible, and also the representatives of all cancers and immunizations in all countries who have helped us, and you've been so patient in sharing your experiences so that we could gather all this information. Now, Can you see my screen? Okay, yes, we can see it. Okay, let me just say that the presentation is in Spanish, okay? So that if you are in the Spanish channel, you need to go to the original audios, and those are there already in English. You don't have anything to do.
As Mauricio already said in the introduction, I want to talk about this planning tool for the incorporation of screening and HPV screening and treatment. So once again, I just want to quickly mention that this is possible thanks to multiple virtual and face-to-face meetings we've had with representatives from cancer immunization, experience exchange, idea exchange that we've had and how we're doing throughout the region. We've had this series of regional workshops between 2023 and 2024 in order to perform the situational analysis, and a lot of that information was summarized in the previous panel that Mauricio presented, as well in the creation of national plans for cervical cancer according to the priorities and the strategic actions from the different countries. And in order to plan, of course, the technical support for the implementation of screening tests, including acquisition by the rotatory funds, that we'll listen to from the next presentation, as well as the planning and implementation of demonstrational projects and the selection and planning of the screening and treatment. I just wanted to show this picture from the meetings that we had when we gathered this information that we were telling you about. We had a few meetings between 2023 and 2024 in Mexico, in Cartagena, Colombia, and in Miami with representatives from all these countries who were kind enough to join us and told us a little bit about their experiences, their challenges, to see how we were doing with the eradication. So, summarizing a little bit about the regional landscape of HPV test, as Mauricio already presented and what they've been discussing on the panel, is that there are a lot of different countries that are reporting to be using test. Something else that Mauricio mentioned that's very important is the way in which we can measure this coverage, which has been an amazing and a great challenge, and it remains a challenge in most countries, establishing what are the different screening landscapes that we're seeing, the algorithm we're following, and how much are we improving or increasing the coverage with the HPV screening test. Even harder still would be to increasing the treatment percentages that do help us have a better understanding of how the third pillar of the eradication strategies, which would be the treatment strategy with the goal of reaching that 0%. So something that we definitely have highlighted and we have learned from all of these different conversations is that we need to emphasize monitoring and assessment even more, even from the planning process. So we believe that this is a very good moment in most countries and context from the region, the way in which countries are planning how can they optimize to do the optimization of the screening for the HPV test, and as how we are receiving the different official guidelines documents to see how to make use of the recommendations from the different algorithms, review of processes, and the monitoring and assessment. So after all of these workshops, regional workshops, we had a smaller meeting with colleagues from countries that have already implementing BPH screening test. And this was meant in the basic indicators test. So just to very quickly mention, which ones are these? Well, these are things that are very simple to calculate. Number of women who have done the screening in a period of time, the number of screens, those eligible, like how many got treatment, then how many were optimized, how many did the screening, how many received a positive test, and then the correct management of those who received a positive diagnosis. What was the percentage of women who received good management? Simple, right? Well, the challenge is that if this information is within an information system, it's going to be in different sources. Why? Because we need a series of information to have it in just one place. We need to have the primary screening results, which is at a first level, then the lab results to know the VPH lab results, then the isopathology results, the management of the disease, and then the cancer management. So the priority here is to see how can we have all of this information in an integrated way in just one space. And if we see this here, this is an example of an algorithm of the different recommendations from the WHO, which is one of the simple algorithms that if we follow every step of this algorithm allows us to estimate the number of women, the percentage that have been there from the previous step, the loss of follow-up, and the time that goes from step 1 to step 2. So obviously, the more complicated, the more steps involved in the algorithm, more indicators of process will we find, and possibly more sources of information will we have to look in order to have full information. So, based on the regional experience of countries who have already been working in producing and trying to monitor and assess the implementation of HPV tests, one of the challenges that usually they point out for us would be the challenge for the management and preparation of data, those that I was telling you, of how can we integrate all of the information that comes from different sources. The validation of this information, how to know if it's being collected in a reliable, consistent way or not, the management of duplicates, when, who, what is counting, and the management of missing information. What do we need to assume when we don't have some information? Another challenge would be for calculating indicators to use the correct denominators, for example, for treatment. It's not just those that got to the hospital, but really we need to see for all of those who received a positive diagnosis, how many received the correct treatment. It's not the same treatment for all women, it depends on what they need. And another challenge for monitoring is to have different reference term. What can we expect for different indicators? So with these challenges in mind, we developed this algorithm exercise, this tool, in order to understand the flow of patients throughout all different services, from the main screening to treatment for those who require, as well as the flow of information for the estimation of indicators. This tool also allows us to project the demand, whether for a pilot project, a demonstrative project, or also for the scalability of implementation at a national or international level, in order to discuss possible bottlenecks of the services based on what is already known about what the priority of the services is, and based also on the projection for the demand and what the existing resources are. It also helps us define standardized actions for the project and discuss a little bit what I was telling you about the expected steps for the different monitoring of the program. So, for example, from how we could see the initial version of this algorithm exercise, we can start with a scheme such as the one we see here, the one that we can see in the recommendations of the WHO. And this is something that we transfer to an Excel file where for every single box of the algorithm, we write down the number of women depending on the population. It could be for a pilot project or for a province or whatever, to play a little bit with the expected percentage of coverage based on the number of women, also having a little bit about playing around with how many would receive a positive diagnosis, having a box here for the positive ones, and then the positive ones in this algorithm, which will be assessed for determining the treatment that they will be receiving. So that goes to a different box. And also to start seeing who wouldn't get to the next step. So the opportunities for losing contact. So this type of algorithm, this is an example of the algorithm of how we could see it in the recommendations, and this is how we would actually see it in the first version of the tool. So it looks a little bit more complicated, you see many more numbers there, but the idea is to start seeing how the cascade of the different steps that women takes through different services, the figures, as well as the projection of demands of different services. Yeah, in blue I have the essential indicators, the percentage of screenings that come on the first box, the positive results on the second box, and then we can see that the percentage of women who have been correctly treated is usually result of several different boxes, because the correct management depends on what was previously found in the previous procedures. So, as I was telling you before, this tool, we have been using it in this version with Excel for every single algorithm, in discussions with representatives from the countries in order to discuss from the scalability of the screening process, to select the algorithm, to project the needs from each of the services. And also, it's worked as a support material once it's implemented or a pilot is open, in order to perform the estimates and the monitoring of indicators, in order to see and understand like how many boxes should be involved for this. So in order to have the logic of who really accounts for every piece of the tool. But this hasn't been just one work, it's been the sum of different Excel files that have been increasingly difficult. If you change one thing here, then perhaps it won't be reflected in another file, etc. So the next step was to adapt this tool to an online tool with the support from the data science in the POW, from the WHO. So we've done this offline tool and we made it online, which will allow us not only to select the algorithm, but to actually be able to build it with the context, with the capabilities, transferring and changing the information as I was showing you in the different boxes, so that we could change the positive ratio, etc. And this way it would be defining also some of the base or default figures and numbers based on the implementation within the region, as well as evidence of study within the region. And the idea would also be for it to help us compare different algorithms, meaning if we use this, then what will this mean for the need of colposcopy services versus using a different algorithm? So I'm just telling you a little bit about how this construction process works. So we would start with the test, because the tool is for the introduction and implementation. So the first question the algorithm does is, are we going to have a differential management based on the gentrification? In this case, it says no. So we have two options. The first one would be positive or negative. Then it's to see, what will I do with the positive cases? So in this case, I'm going to be like, it's going to be a visual screening, a visual test, in order to determine what the treatment is going to be. So it's going to be identifying a treatment algorithm. So we do that, and then we have these three options. But then we see, what will we do with this algorithm? So those who are eligible for treatment, we have this here, and then we will need to say, like, what are we going to write for those who are not eligible for the thermal ablation? So we put that here, and this is basically the second algorithm, which would be the WHO recommendations. So it depends on the algorithm and seeing how it looks on the tool. So first we answer these questions, and then we have this other term, like based on the certification, let's say yes. How am I going to manage these, the 18, the 20, the high risk ones? And in this case, once again, we go for the assessment of treatment. The ones who are not eligible for thermal ablation, then I'm going to click here. And once again, here we have different, like high risk HPV, visual inspection with acetic acid. So we did that, and then we have the fourth algorithm, and we could say that this algorithm is quite more complicated than the one we were just seeing. And we need to consider also, as part of the exercise, what all of these different additional steps entail based on services, as well as for the monitoring and assessment. So I've showed a little bit about how we can see this in the regular version now. So this is going to be the initial interface. We would select the algorithm, and in this case we're going to be like, no, there's going to be no differential treatment based on the gentrification. We're going to be doing an assessment for the treatment, and those who are not eligible for thermal ablation, then we're going to be sending, and like as we had said here, it's going to send us to the second algorithm. This is a little bit scary, of course, because the algorithm is showing in full, but there's an option to really zoom in and start analyzing it more in depth. So, but what I wanted to show you here is that first of all, we have a summary chart here from the essential indicators, and also as you can see in each of the green boxes we have some that are highlighted in green, which would be numbers and percentages that we're going to be using in order to do different projections, different scenarios, and seeing how these different scenarios will be changing or having an effect in the essential differentiators. We can see that there's a series of red boxes or pinkish boxes in each step that will be the opportunity or more likely the risk of losing them in the follow-up in each of the different steps for the algorithm.
Now, in this part, when you will see, just to show you that, for example, here, I'm showing you the loss of percentages, and these are relatively small, but it may have a huge effect in the last percentage or the main treatment indicator, because this will be accumulative. It's not only that 10% that did not arrive to the last step, but it is an accumulation of the effect of losing women. So the idea of having this tool is to be able to play a little bit with the numbers and determine when can we have a problem that will take us to, first of all, not to allow or not give the proper treatment to women, and also to affect the essential indicators. Also, the tool, I mean, we moved the essential scheme. I know it's huge, but in order to show you a little bit how it works, we go to the algorithm scheme. It will give us the summarized algorithm, and this is how the format we get according to the WHO, in order to make a reference of the main points and all the little boxes that I've been telling you and what the things that we need to change. And just to tell you a little bit of this, we're still developing these, but we want to add to this tool a summary. Aside from the basic indicators, also we want to add a expected number of treatments. For example, if we have a triage test, or how many visual inspections we will need, the expected number of procedures as thermal ablation, LEAP, and to be able to have all these services on the side of human resources, as well as the need of having additional staff in order to be able to perform these procedures. And lastly, what is the expected number of women that will need the treatment? That definitely, I mean, it's not the less important, but this is an emphasis that we need to make. We need to ensure that those women diagnosed with a diagnosis, they have the proper treatment. Something else that we would like to add in the following steps is to have a comparison between the different algorithms. So once that you can do this, and what happens if I implement number 2 or number 3, just for saying something, and something else that we're doing with the health authorities is how to preload all the information about the population according to the geographical area. And what we're doing, well, we're actually already using the tool on a spreadsheet, and the idea is to be able to use this tool online with a technical cooperation that we are supporting in a lot of countries in order to be able to do the testing. So this is just a little bit of what I wanted to show you. And I did the selection of the algorithm without any typification in order to be able to show you this. And this will take us to the sixth algorithm of the World Health Organization. And we can do zoom a little bit. Here, this is the summarized table. And here, for example, we have a positive rate of 12%. But if I want to zoom in, No, sorry, it's 20%. So this is going to affect us, the number of colposcopies. So we could say, no, I don't believe that I can run 1,680 colposcopies. So truly, what I am expecting is to be able to do half of these. So in here, you will be able to see the number of treated people and how this change. For example, if I go like, okay, this is I'm going to do half of them, half of the colposcopies. Wait a minute. Let the system load the information so I can show it to you. And it goes down to 46%. So what does this mean? That possibly within the context, this context, when I do not have the possibility of supplying colposcopy to 2,800 women, I'm going to provide only 50% of it. So then I'm not going to be able to get or to reach the goal of treatment. So it would be best to consider an algorithm that does not depend on the colposcopy by itself. So this is just an example. Of course, we will keep working on the tool so as to improve it. And well, that's it on my behalf. Thank you, Mauricio. You have the floor. Sara, thank you so much for sharing such an important tool. I believe that we feel so pleased to see how the close collaboration between different stakeholders help us to provide this information. I know that this evidence comes from the projects that we have in the region, and the fact that we can find this and how to create the best evidence so that countries learn what is the real status of their programs. And as you can see, for example, how to identify it afterwards. When we talk about the indicators, this is something that we see a lot. And we want to underscore Tiara Hernandez and the area of evidence and intelligence for health evidence. Thank you so much, because you're helping us to make this tool the best possible tool so that we can be able to have access to it. So again, thank you so much. We will be using all this information in the next missions that we have. We have plans to go to the Caribbean region, to South America, and we hope that we can start testing this in other countries. Soon we will have Guyanas, Grenadine, Dominican Republic, and we hope that we can use this tool with all of you. Sara, thank you so much for your hard work, and thank you for publishing this. Now, when we talk about our strengths as an organization, as the PAHO, how can we work between different areas? The project that we have with Unitate in order to ensure that we have more access to HPV treatment. This has been a huge effort with procurement and other regional promoters. So I am very pleased to be able to present Santiago Cornejo. He is the manager of the fund, so that all the countries can see all the things that we can offer in terms of screening, equipment, vaccines, so as to be able to ensure the elimination goals or targets that we have. Santiago. Mauricio, thank you so much, and thank you for inviting me here and to have the opportunity to be able to show the work of the funds in this important event. Now, when we talk about the world of the regional revolving funds of the PAHO, this is not a work of one individual. This is a interprogrammatic work that starts with the guidelines and of the technical team that we heard from today, but it also works with the partners that we have here today, that we have the Spanish agency, IAC, Unitate, and other technical partners that we work with as Leander said. But of course, the success of the funds depend on the support and the use of the of and the help of all the member states that help us to be able to achieve all the success that we've been able to reach. So I'm going to show you about the funds now. I'm going to start in Spanish and then I'm going to move into English. So the revolving funds from the the PAHO involves revolving funds and the strategic funds. These are technical cooperation mechanisms to enable the Americas uh, to access equitably in a timely, quality manner to vaccines, essential medicines, and all the public health supplies. The main purpose is that they can have access to it in an on-time manner. Again, a big feature of all these mechanisms is the demand consolidation, and by doing so, we may have a preventable procurement funds that will help us to be able to provide a better condition to the member states. And the member states, as I was saying, they are the ones who truly define the success and the achievements of the Rotary funds, and the member states were the ones who created this RRFs, and the PAHO we only manages the funds, but the member states are the ones who created, defined, and the priorities. They decide when they need to have substantial changes, and by means of these every year they help us to grow as a region and also help us to be sustainable, because every mechanism that we can obtain is thanks to the use of the help that they help us with. Who are the ones that participate on this? Practically all the countries from the region, 33 from the region, they have bought some supplies by means of this fund. And also, not only the countries, but also territories. We have 42 in total. Of course, we work mainly with health agencies. But this is not only the public mechanism that we work with, we also work with institutions, cancer institutions, with safety boxes or the insurance companies, also with subnational networks like provinces or other areas. So we work with all the public entities to ensure that access to essential supplies. We are estimating that by 24-25, more than 171 million people in our region have been impacted by the funds or received service by this Rotary revolving fund. Sorry. So when we see the vaccines, for example, we bought approximately more than 234 million vaccine doses. And that economy that we've managed to obtain help us to get better conditions. We did a survey where we compare the prices of the vaccine packages in our region compared to the cost of that same package in countries of middle income in a region that they buy the vaccines bilaterally, and we see a difference or a savings through the funds of a 50% compared to the prices that they may access in a bilateral manner. We've also achieved consolidation in terms of treatment, diagnosis, and today, let me just say this in this important day, as a request from the member states, we have started to consolidate the demand for cancer treatments, for pediatrician cancer and other types of cancer. So what we have seen is that some of the prices that we've gotten for some of the treatments compared to the prices that some of the countries have shared with us, there's a difference up to 90% for the same treatments. So again, I invite you to be able to go over the information and to access all of these opportunities that we may have through the funds. Now, Now we're talking about cervical cancer. So, what are the main challenges and barriers that we see in terms of access to supplies for cancer treatment? The first thing that we see is that the regional supply, there is a limited supply security, mainly because there is a low visibility of the demand to be able to access to either medication or devices. Now, when we go when we see platforms and with widely fragmented procurement modalities, and that's why we have high local equipment costs. And it's not only the variability in the platforms, but also that the clinical protocols are not uniformed in all countries. So this is also something that will bring a lot of complexities. And these are all the barriers that, as the fund, we work to with the technical teams so that we can try to give a solution.
Inglés, así que para los que están escuchando en español, que puedan acceder a la traducción.
So I'm going to be changing in English so that everyone listens in Spanish.
Approach for the elimination of HPV, and here what we have, here we're looking at, from one hand, the quantification, the technical cooperation through the different tools, and my colleagues have presented some tools. We have other tools like QuantMed to estimate demand of products, or for our online platform for vaccines. So, but then what you can find is a comprehensive supply from prevention, vaccines, HPV vaccines, for testing, the different tests that they are available, but also treatment, the different treatments, equipment needed from precancer, like thermal ablation devices and colposcopes, and also for invasive cancer when we're talking about more palliative care. Next slide. And I will go a little bit in detail about some of these different offers. It was briefly mentioned in the statistics when we look at the HPV vaccine in our region through the revolving fund. We have up to 35 countries and territories that have introduced this vaccine in our region. When we look at, they basically mainly is the quadrivalent vaccine, but also some of them have looked at the bivalent, and now what we are seeing is more countries migrating towards the nonavalent vaccine that they can access through the revolving fund, and we have even 7 countries that have already transitioned to this nonavalent vaccine. We did an analysis of looking at the quadrivalent vaccine, and thanks to the consolidation of demand that we can do in our region, we have that countries are saving for this specific vaccine 3 times compared to the prices that the similar countries are accessing through bilateral biddings. And not only this, what we are looking is we're continuing to improve our conditions. We have continued have reduction in our prices, 10% since the previous year, to try to have more affordable vaccines in order to allow countries to utilize this excellent technology. And we continue to monitor the market, as we see there are many vaccines that are in the process of developing in clinical trials, and we continue to monitor this pipeline in order to have the technologies available for our region. Next slide, please. So, but a very important tool for cervical cancer elimination, of course, is diagnostics and the test. And here also, through the revolving fund, through the strategic fund in particular, we have offered different type of tests that countries can access from different brands, different type of equipment. And of course, this is not just the test that is available, but also the equipment. And again, thanks to the consolidation of demand, countries participating. Of course, we're seeing also savings compared to some of the tests and prices that are being paid in the region, up to 50% compared to the prices that we have in our revolving funds. Very important to highlight, and you see it here, all the products, either just vaccines, but also tests, of course, that the equipment is the revolving funds, PAHO, through our technical teams. We evaluate the quality of these products. We ensure that the products meet our WHO and PAHO standards of quality, and that's what you see in many cases. Most of the products are either, all of the products are either WHO pre-qualified or at least approved by an agency of reference for according to our technical teams of quality. Next slide. And of course, one of the new areas that I share that we are looking at is on medical equipment. And here again, also you can have access through the revolving funds to a different, very different platform, different equipment that and levels of support that you would like to introduce, or you can utilize at the different levels of your system, from video coloscopes that up to ones that they are together with thermocoagulators, the thermocoagulators, or electrosurgical generators. As you can see, there's a wide range of technologies that you can access. Very important also, here we're just having estimated price, that in addition to the prices of the equipment, we have negotiated services package in terms of training, maintenance, and warranty that also you can access while you're looking at to procure or to introduce many of these very important technologies to help to treat cervical cancer. Next slide. And you can look at all of these products. I just, given time, just gave a very high level presentation of the products, but you can come to our website, our portal for the member states, but in our website where you can see all the different products that we have available through the revolving funds. And if you look at now, it's consolidated. So if you look at Better Care for NCDs, and here for NCDs, you will have all the different tools that we have in the revolving funds for NCDs. And then you can look at, and you can specifically, if you want, go to the priority areas, for example, cervical cancer, and there you will have all of these equipments, from diagnostics and vaccines. So all of them, so you can really assess and look at what is, and have a comprehensive access to the different technologies that are needed for the elimination of cervical cancer. Next slide. But as I was mentioning, it's not only about the equipment. What we offer as PAHO is the full technical support that starts with our technical units, Mauricio, Tara, and all the technical teams of PAHO in the selection of this of the equipment based on your context, what is needed for your specific country. Looking at also the supply chain, looking at what is needed for the ensure not only that the product is available in the country, but is available where it's needed. Then to the different tools that we have developed to quantify, to plan, and to have these acquisition plans through our platforms. Then, of course, we work on management, on the contracting issues with the suppliers, to have access to the different devices or medicines or vaccines. And as I was mentioning, very important, it's not only about affordable products, but it's quality assured products. All the products that you have access through the revolving funds meet the standards and criteria of WHO and PAHO. Then we support you through the tracking, the logistics of the shipments, and now you have access to, through the portals, member states have access to look at where those shipments are, to where, in which stage, when they will arrive to your country. And then, of course, through our support, our technical support in the monitoring and verification that of the stocks. Next slide. To conclude, so I would like just to mention some of these opportunities and advantage of that the region have, our member states, through the revolving fund, which is a unique mechanism. Our region is the only region that have these mechanisms that allow us, on one is to have this, as I was mentioning, this economy of scales to deliver significant savings in terms of vaccines, tests, and devices. Also, we are looking at now through the revolving funds to work not just with the national but also subnational. We know in many of our member states the financing perhaps of equipment, of tests is decentralized. So we are also working to supply and to work with subnational entities to ensure equitable access to all of the populations in our region. We are working also to strengthen and incentivize regional manufacturing. This was a request and a priority established by our member states in 2024. So we are working to support regional manufacturing and technology transfer of some of these technologies and we hope that this year we'll have some announcements of working together with our regional suppliers to have more resilience of supplies in our region. And another advantage, as you saw, is that while there are many programs that work towards elimination of cervical cancer, what we provide is this integrated and comprehensive supply of all the different technologies that you need towards elimination, from vaccine, diagnostics and treatment, and devices, and we can coordinate that supply of the different technologies that you will need for your country. And of course, working together with the technical units to ensure that you are forecasting those supplies that are needed based on your populations, and that we can have a predictable demand, because it's through this predictable demand that we can obtain better conditions for all of you. So I would like to thank you again, and we're from the revolving funds. You have here the next slide, the QR code. Please access our catalog. Our strength as revolving funds is your participation, the member states' utilization of the funds, and the more you participate, the more everyone will benefit in our region. And again, thank you very much, Mauricio, for this opportunity to present the work that we're doing together to have our region have access to all the technologies needed for cervical cancer elimination.
Muchísimas gracias, Santiago. En realidad, sabemos que
Thank you
desde
so
que
much, Santiago. We know that since we first started in working on how to accelerate the eradication, one of the main barriers has been access to test, screening, and material at an affordable price point. And all of the work that has been undertaken makes us certain that we'll be able to offer that, just as you presented, will help decrease considerably the current cost all countries are paying. So thank you so much for your presence and for having shared this with us. So just to start finishing things up, I would now like to give the floor to Silvana Rossiani. She is the Chief of Non-Transmittable Diseases here in the PAO, and she'll give us the closing remarks for the day. Thank you so much, Mauricio, Santiago, Sara, the entire PAO team, for this motivating and encouraging webinar. Seeing over 800 people connected with the full commitment and support we have in the LATAM and Caribbean region for the eradication of cervical cancer is amazing.
Community to commemorate World Cancer Day. And each year on this day, we like to bring that message of hope, more optimism, more faith that really we will conquer this devastating disease that affects way too many people. And that's precisely the message that we want to leave you with today as we conclude the PAHO webinar on accelerating cervical cancer elimination. we're highlighting again that cervical cancer elimination is possible through HPV vaccination, screening, and treatment of precancerous lesions, because we're already witnessing some really steep declines in precancer and invasive cervical cancer following HPV vaccine introduction and HPV test introduction, which, for HPV vaccines, we're going on to now 20 years of introduction. So we're really starting to see the impact in many countries around the world. Just as some example, here in the United States of America, there's already an 80% decline in precancerous lesions since 2008. England and the UK, they have observed also more than 80% decline in cervical cancer incidence in women that have been vaccinated. And Australia is perhaps the world leader, showing significant declines in precancer. And just recently, they had 0 cervical cancer cases reported in vaccinated women under 25. And they're projected to be the first country to achieve cervical cancer elimination. But of course, in Latin America and the Caribbean, we know that many countries are already making great strides towards those 90, 70, 90 targets for coverage of HPV vaccination, HPV testing, and treatment. And we know that's a result of the incredible work that many of you, through the Ministries of Health, civil society groups, are already implementing. And as you saw in today's webinar, we at PAHO are really committed to support the Ministries of Health in these efforts with our new tools, the strategic fund, revolving funds for HPV vaccination, HPV tests, devices for treatment of precancerous lesions, and of course, cancer medications. And then the wonderful new cervical cancer planning tool, the wonderful new dashboard to monitor progress. And we're really thrilled, and we really invite you all to visit the PAHO website and use all these resources and tools to help accelerate cervical cancer elimination. But we also want to recognize that our impact will be even greater when we work together with all the stakeholders. And in this regard, we are so deeply grateful to Unitaid for the really moving the needle on expanding access to HPV testing and thermal ablation for precancer treatment, and the support that they're providing to us in the Latin American Caribbean region. And we are also deeply grateful to IESID for the incredible political, technical, financial support that we are receiving for Latin America and the Caribbean to really help advance cervical cancer elimination. And to, of course, all of our partners at WHO, IARC, IAEA, MD Anderson, University of Miami, Florida International University. I mean, there are so many actors and stakeholders, and of course, all of you who are working very intently to eliminate cervical cancer. So thank you all again for your participation in the webinar today, to all of our wonderful presenters for showcasing the great work. And thank you. Join us in our efforts in Latin America and the Caribbean. Stay in touch with us. Use our resources at PAHO. It's such an exciting day and an exciting webinar. I hate to conclude it, but it's time to conclude. So thank you again, and we'll stay in touch. Gracias. Que tenga un buen día.
Gracias, Silvana.
Gracias.
A los ponentes le estamos solicitando si pueden encender su.
Thank you and goodbye. If speakers could please